Dr. Durenzio, can you tell me a little bit about if the family's saying he's bipolar schizophrenic medically, what is that?
Sure. So typically when we look at those two diagnoses together, it's usually called schizoaffective disorder. And that means that those two diagnoses are co-occurring, meaning schizophrenia and a mood disorder such as depression or bipolar disorder.
The family's perception of that is that it was a drug that changed him. Is that something that you've ever seen, like a drug brings on schizophrenia?
Schizoaffective or schizophrenic? Well, it really depends. So we don't really know the cause of either of those disorders, the bipolar or the schizophrenia or the schizoaffective disorder. But there is some literature that does speak of drug use or significant periods of stress or chemical changes within the body, but also brain structural problems or changes that occur that lead to these diagnoses. But overall, we really don't know a specific cause.
And at what time in life does this diagnosis generally present?
Sure. Well, typically, if we're talking about schizophrenia, it's usually in the early 20s for males and in the later 20s for females.
Okay. And then the bipolar aspect can be at any point in one's life, or
bipolar is similar too, but it's often a little younger, like in the high school years or when somebody's going off to college.
Okay. If someone's suffering from that kind of a diagnosis, do they run a risk of typically being violent?
Typically not. Most people with schizophrenia are not violent, or even people with bipolar disorder are not violent. There are very few that are violent. The more violent type would be paranoid schizophrenics, but again, most of them are not violent either. And know too that this diagnosis is very. There are not many people. The prevalence rates are like 0.1 to or 0.01 to 0.03% of the population. So very few people have this, and then even fewer, many fewer are violent.
So the family says he doesn't speak really at all. The community finds that to be concerning. If someone is suffering from this disorder, is it possible they don't understand what's being said to them?
Well, it is possible with schizophrenia. One has negative symptoms, or where everything really slows down, or they become catatonic, where they are just very slow or very still. And often things are slow for them internally as well as what they generate. So it is possible that they're not hearing or understanding what people are saying to them.
In this disorder, is there like a sexual component to it at all? Hypersexual?
It depends. With the bipolar, there can be a hyposexual component with the mania part of the bipolar. So where somebody is fixated on a certain behavior, or they're engaged in high-risk behavior like some type of sexual acting out, yes.
How complex is a diagnosis like this combined with our legal system?
Sure. This diagnosis is extremely complex regarding the legal system, because these people go in and out of potentially being dangerous to themselves or dangerous to others, and then they get hospitalized, and then the hospital quickly finds them stabilized, they give them extra medication, and then they get released on the street, and then or to their own reconnaissance or to their families. And if somebody doesn't have a family that has the resources to care for them, then these people are often back on the street until another event happens. They get rehospitalized, and then again they're back out on the street. So these people are often not very compliant with medication either. So they may get medication while they're hospitalized, but quickly they stop taking the medication again, or they run out and they can't get another prescription, so their symptoms inevitably reappear.
How dangerous is this cycle?
Well, the cycle is most dangerous for the ill person and not for other people, because not being treated, I mean, they're liable to put themselves in very dangerous situations. They're liable to smoke very heavily, even commit crimes, or they're most likely though to be the victim of a crime themselves. So it is a very dangerous situation.
So